everyone, welcome back to Alcove Health Women's Clinic. I'm Sherri, Client Relations Manager, and today in the clinic I'm here with Meg, one of our marvelous nurse managers. And oftentimes we get women who call and say, I've taken my home pregnancy test, it's positive, I know what I want to do, I think I might want an abortion, I'm going to move on because I have all the answers I need. And you would say,
actually, not so much. It opens the door to a lot of other questions.
Okay, so questions like?
Well, there's questions like this. And then there's questions like this. And then there's questions like this.
And don't forget this question, Meg. It also does not answer that question, right? It actually opens up the door to all of these questions.
Yes.
So, but there is a way that we can answer all those questions, right?
Yes.
Okay.
Yes, with a transvaginal ultrasound.
Okay, you're going to have to explain transvaginal. We understand ultrasound, but transvaginal, what does that mean?
So a transvaginal ultrasound is just the name of the transducer that we use to place in the vagina so that we can see directly through the cervix. It gets us closer to the pregnancy because things are so small. We want to be able to get close to get those accurate measurements, to know where it's implanted, to measure a heartbeat, and to measure the size of the baby.
Okay, and so the question that's going to come to you for a camera clinic and a question is, why does it have to be a transvaginal ultrasound? We get that question all the time. Why, Meg?
So first of all, I want you to know that we start all of our ultrasounds on the abdomen. We want to be able to get a survey of the pelvis. Now, most of our ultrasounds that we do here are going to be under 12 weeks.
Right.
And the standard of care for under 12 weeks is to do the transvaginal ultrasound so that you can get close enough to the pregnancy to gain all that information. Our real purpose is to provide accurate medical information.
Okay. So it's not like a transvaginal ultrasound is a tool among many tools under 12 weeks that can get you that information. It's the only one that's going to get you answers to all those questions. And anything done on the abdomen is not going to get you accurate enough information for making a safe decision for your reproductive health.
Exactly. Okay. Exactly. Yes.
All right. And so for the young woman listening out there, like a lot of times we get moms who this is not their first pregnancy and she doesn't bat an eye about a transvaginal ultrasound.
Right.
But if you're not expecting it, and maybe for our young women who've never had a pregnancy before, who've never even visited a gynecologist, not had a pelvic exam, it's a little daunting, and their worry is it's going to hurt.
Right.
What about that?
Yeah, that's a real priority for us, is the comfort of our patients.
Right.
So we take our time, we make sure they understand, and we give them control. They're asked if they'd like to place the probe themselves. It gives them a sense of control. It helps them to feel the most comfortable. And it should not hurt. If at any time it does hurt, we want to stop the exam. But honestly, they do not hurt. Yeah.
Okay. And as with all of our services, the services that we do come because the woman has consented to those services, right?
Absolutely.
Okay.
Yes.
Okay.
Yes.
That's important. Important for you to remember that.
Yes.
Now listen, we know there's a lot of talk going on outside. We know there are a lot of voices. You might have a lot of people, even in your community, that are talking to you about your pregnancy. Our goal is to hear your voice. Our goal is to answer your questions. And the questions that Meg talked to you about a moment ago, they're really important questions that you need answers to before you make that decision about what you're going to do next, especially if you're considering an abortion. So what we'd like you to do is find our website on the end screen, contact us today, request your free and confidential appointment because all of our services are free, and we're going to get back to you as soon as we can to set you up with that appointment so you can get answers to all of those questions so you can make a good decision for you.
Yeah.
Right?
Yeah.
Thanks, everyone. Have a great day. Bye.
Thank you. Bye.